PRISMA, the results of the study PRISMA that we're presenting this year at ASCO PRISMA was a prospective study in which we we enrolled patients with metastatic triple-negative breast cancer, and these patients underwent PET PSMA and a PET FDG at the time of disease progression in the metastatic setting. So the idea was, of the background of this study and the purpose was to evaluate if a proportion of these patients would have a high uptake of PSMA in the PET PSMA imaging. The idea to do that came from the fact that we already have preclinical data demonstrating that some patients with metastatic triple-negative breast cancer do have a high expression of PSMA in their tumor regions, and the idea would be to explore if these patients could have a high uptake of PSMA in the PET imaging, so that we could maybe in the future use this protein as a target for treatment, for therapeutic with radioligand therapy. So here at ASCO, we are presenting the first results of these prospective studies, and we did see that a proportion of patients with metastatic triple-negative breast cancer do have a high uptake and a high expression of PSMA when we look at their imaging in the PET PSMA that we performed. So these results that we are showing here are the imaging studies, but with the very early results that we are presenting here, we already saw that since some patients have a significant uptake, this could be a strategy that we could explore in another study as a therapeutic target for radioligand therapy using PSMA as a target for this population. So that's what we're planning to do next. A part of our challenges and the next steps that we want to explore in this study are related with the fact that we don't know exactly which patients are going to have a high expression of PSMA. We already know that triple-negative breast cancer is a heterogeneous group of malignancies. So the immediate next steps that we are planning to do are to explore biomarkers that could help us predict which patients would be more likely to have a high uptake of PSMA, and as a consequence could be a good candidate for the treatment study in which we're going to try to explore if this target could help us treating this population that has still very limited treatment options, and that really needs some innovative approaches so that we can improve their outcomes in the future.